Hi everyone. Today we will discuss about the most important topic for MSN, hypertension. What is mean by the hypertension? Definition. Hypertension is a chronic medical condition where blood pressure in the arteries is consistently elevated. When the BP is consistently elevated a certain time is more than normal, it is known as the hypertension. Normal BP is 120 by 80. When the BP is increasing by the 120 by 80 pre-hypertension, then it causes the hypertension. When the BP is more than 140 by 90 mm of Hg, according to WHO, according to WHO, is known as the hypertension. Classification. Category: normal systolic BP 120 by 80, 120, and diastolic by BP is 80. Pre-hypertension when the systolic BP is 120 to 139 is known as the pre-hypertension systolic BP, and pre-hypertension diastolic BP 80 to 89. So the systolic by diastolic 120 to 139 by 80 to 89. Stage 1 hypertension. Stage 1 hypertension when the systolic BP is 140 by 159 and the diastolic BP is 90 to 99 is known as the stage 1 hypertension. And second stage of the hypertension is when the systolic BP is greater than 160 and diastolic BP is greater than 100 is known as the stage 2 hypertension. Types of hypertension. Primary is essential, no identifiable cause. Secondary, due to identifiable cause 5 to 10%, like renal disease, endocrine disorder like Cushing syndrome, pheochromocytoma, medication, oral contraceptives, non-NS, AIDs, non-steroid anti-inflammatory drugs, pregnancy like pregnancy-induced hypertension, preeclampsia. Risk factor. Non-modifiable risk factor. Non-modifiable risk factor means which cannot be modified in the future, or this is not our hand. This is known as the non-modifiable risk factor, like age, family history, race. And modifiable risk factor means where we can change the situation or our body or habits, like obesity we can change, smoking we can stop, alcohol also we can stop, stress we can control during the situations, high salt intakes we have to avoid, sedentary lifestyle, and diabetes we can control. Pathophysiology. Increase the cardiac output or peripheral resistance. When both are increased, then the BP will increase. Chronic BP increase when the damage of arterial walls, atherosclerosis, like this is the arterial walls, artery. When the damage of the arterial walls, atherosclerosis, what will happen? The arteries will block and the blood can't flow properly. What will happen then? Then the BP will increase. When it can't flow properly, the blood can't flow properly through the arteries, then BP will increase. Then affected organs like heart, brain, and kidneys or eyes. Sign and symptoms. Often called the silent killer because it usually asymptomatic when the symptoms appear, especially headache, especially occipital in the morning, dizziness, blurred vision, chest pain, palpitation, epistaxis also can be occurs. Targeted organ, heart, MI, myocardial infarction, then left ventricle hypertrophy, heart failure, brain, stroke, TIA, kidneys, chronic kidney disease can be occurs, eyes, hypertension, retinopathy can occur. Diagnosis: BP measurement. Take two readings 2 minutes apart of both arms. Urinalysis for the proteinuria, blood test, CBC, lipid profile, serum creatinine, ECG for LVH, fundoscope for the retinopathy. Management or treatment: lifestyle modification, first line treatments. DASH diet means low sodium diet, high fruits and veggies. Take more fruits, increase in diet, more vegetables and the high fruits. Decrease the sodium, low sodium diet. Weight loss and regular exercise. Salt restriction: normal salt is 2.5 gram per day, then take less than 2.4 gram per day. Avoid like alcohol, stop smoking, stress reduction. You can do the yoga, meditation you can do. Pharmacological treatment: drugs class, diuretics, example hydrochloride, thiazide, furosemide, ACE inhibitors, enalapril, lisinopril, and ARBs, losartan, valsartan, beta blockers, atenolol, metoprolol, calcium channel blockers, amlodipine, nifedipine. Hypertensive crisis. What is meant by the hypertensive crisis? When the BP is more than 180 by 120 without organ damage, suddenly it's occur. It's known as the hypertensive urgency or hypertensive emergency. Hypertensive emergency means when the BP is more than 180 by 20 but with the end organ damage. In the hypertensive urgency there is no organ damage, but in the hypertension emergency there are end organ damage. Requires immediate IV hypertensive nitroprusside levotalol. Nursing responsibility: what are the most important nursing responsibility? Monitor vital signs and BP regularly, then assess for the signs of organ damage. Educated the patients, medication adherence, lifestyle modifications, diet and exercise, monitoring BP at home, prevent the complications by early detection. Complication: stroke, MI, heart failure, renal failure, retinopathy, vision loss. Then mnemonic for the risk factor of soda: S for sodium and sugar intake high, O for obesity and sedentary lifestyle, D for drinking alcohol and smoking, A for age and African American ethnicity. Thank you everyone. Please like, share and subscribe.